Now we move to the pandemic tonight. State health officials say that COVID is spreading at a faster pace than previous surges. We've got Brooke Katz looking at those numbers for all of us tonight and also the warning that's coming with it. Brooke?
And Doug, not just new cases, but also hospitalizations and deaths are all rising. State health officials shared some good visuals for comparison. So let's focus in on hospitalizations because that represents the more severe cases. And no, we are not at the height of the pandemic, but the concern is if the trend continues, we could be. Now, the chart here shows a red line, the first wave that we saw starting back in June of last year. Yellow, wave 2 from October to January of this year. And the blue line, that's the current wave. And you can see it appears steeper at this point than the others. Hospitalizations across the state are up 49% from just the last week. And health officials say these are younger people than we saw in previous waves, including children. And the overwhelming impact is on those who are not vaccinated. Health officials say it is great that vaccination rates are ticking up. And now is the time to act if it's something you're considering.
We know that these vaccines work, even against variants like Delta. We know that no vaccine is perfect. They never will be. And so there will be some breakthrough cases. And this is especially true for people who might not have a strong immune response to the vaccine in the first place.
So that is Chief State Epidemiologist Dr. Jennifer Shuford. She says for the most part, those breakthrough cases have been milder, shorter illnesses. She said less than 2% of deaths were in fully vaccinated people, and most of those cases involve people with conditions that put them at higher risk. Doug?
Okay, good info. Brooke, thank you so much. We also got this. 2 North Texas hospital networks catering to children specifically, now requiring COVID vaccines. All employees, volunteers, even vendors for Children's Health and Cook Children's Healthcare are required to be vaccinated. Cook Children's has set a September 27th deadline. Children's Health, they have a October 1st deadline. And as we first told you last night, Dallas County has now moved back to a COVID level, threat level of what they call red. And for them, that's the highest level on the county's coronavirus risk scale. Medical advisors moved the level back to red because of the increase in COVID cases and the number of people in hospitals. For the unvaccinated, it is recommended basically you stay home as much as possible. For the vaccinated, the suggestion is you avoid large gatherings and wear masks when you're indoors. But be clear, those are not requirements. They are only recommendations. And the number of open hospital beds, again, becoming a concern. 83 staffed ICU beds are open right now for the most critical patients at hospitals across North Texas. Overall, the number of people in hospitals with COVID-19 is rising pretty quickly. Exactly 1 month ago, July 4th, 398 people were in North Texas hospitals with COVID-19. Today, look at the number, 1,922. The DFW Hospital Council says almost all of those are unvaccinated people.